an environmentalist for this invitation to be amongst you to deliver a very important and a really hot topic nowadays in the present context, that is the environmental issues in prevention of congenital and acquired heart diseases. In fact, the environment is so important, particularly because what people say and what people is known to many is, yes, this climate change or environment has got more impact on respiratory illnesses. But what is less known is what is this adverse impact on congenital heart disease, or in that matter, as far as cardiovascular disease is concerned. So it's a very important thing. I will just see, the world is going through many major threats. Number one, we are into loneliness and job losses. And the second is water and weather crisis. So that is the important topic. That is topic of the day. That is water and weather crisis. And we have a vulnerable economy and lifestyle diseases. And of course, of late is COVID-19 pandemic. So these are some of the important major threats we are going through. And let me address what is the role of environment today with respect to congenital and acquired heart diseases. If you just recall the stages of epidemiologic transition, in fact, we have moved from malnutrition to air pollution. So in the first stage of evolution of the epidemiological transition and evolution, malnutrition and infectious disease were the common causes for mortality and morbidity. At that point of time, the life expectancy was just 35 years. Then we moved to stage 2, that is receding pandemic, and that was a stage where there was improved nutrition and also reasonably good public health measures, and most of the mortality was coming from chronic diseases and hypertension. So the life expectancy from 35 years went up to 50 years, and this is stage 2. Then we moved to stage 3 of epidemiology transition, that is a degenerative and man-made diseases. See, today, if anybody dies before 50 years, it is due to his own problems, it is due to his own habits, and along with that, there is an additional risk factor, environmental issues. So it was this stage, there was increase in fat and calorie intake, tobacco usage also went up, and chronic disease deaths mainly because of these infections and malnutrition continued. And added to this list, there were hemorrhage, stroke, and ischemic heart disease, and the life expectancy was around 60 years. Now we are into stage 4 presently, that is delayed degenerative diseases. Because as the lifespan increases, obviously a lot of degenerative diseases will come into picture. The leading cause of mortality and morbidity today is cardiovascular disease as well as cancer disease. And as a result, the prevention is extremely important. So the most common cause of death today is due to delayed degenerative diseases. The important players in this group is cardiovascular disease, diabetes, hypertension, stroke, cancer. These are the important things. So what are the lifestyle diseases in front of us? One is cardiovascular disease, second is high blood pressure, third is diabetes mellitus, stroke, cancer. Another important lifestyle disease that is added recently is what is called screen addiction. Screen addiction because a lot of us are glued to televisions, the computers, or iPads, or mobile phone. And 1 in 8 in India is suffering from screen addiction. And today, screen addiction is a mental disorder. And this is one of the reasons why many lifestyle diseases have gone up. So if you look at the spectrum of heart diseases, this is our own data from Jayadeva Institute of Cardiovascular Sciences. It is basically a public tertiary care super specialty heart hospital. And 65% of our admissions are due to ischemic heart disease. In the same country or in the same city, if you go to a private sector, 95% is due to ischemic heart disease. And 20% is contributed by valvular heart disease, And today's topic of the day, that is congenital heart disease, accounts for 10%, and cardiomyopathies and others accounts for 5%. So let me come to the topic. What are the environmental factors that can affect heart diseases or that can be a risk factor for congenital heart disease in children? These are some of the possible causes of congenital heart disease. At the level of fetus, we have chromosomal abnormalities, single gene and polygenetic inheritance, and assisted reproduction and vitro fertilization. That is always say nature is always ahead of technology. Trying to artificially produce a lot of things results in a lot of health problems, and family history is also an important cause for congenital heart disease. Under the maternal causes, we have, I will enlarge upon this in the next slide, the drug intake, obesity, alcohol, and smoking. In fact, because of urbanization, industrialization, and mechanization, a lot of these things are happening, particularly the alcohol and smoking, particularly in bigger cities or tier A cities. Many ladies are, because of these lifestyle changes, they are sticking to alcohol and smoking. And let us examine what is the impact of all these things on fetus or on the infants born to these mothers. So if mother is diabetic, what are the chances of getting congenital heart disease, and what type of congenital heart disease they can get? One is the commonest cyanotic congenital heart disease, that is tetralogy of Fallot, then transposition of great arteries, then atrial septal defect. Atrial septal defect, of course, all doctors know about it, but for non-doctors, we can always say there is a heart hole. ASD means heart hole. Transposition of great arteries means arteries are arising from opposite ventricles. Then the infant also can have a high blood sugar level and formation of free radicals resulting in apoptosis and mitochondrial damage. See, this is the impact of maternal diabetes on their infants. Then maternal rubella can give rise to patent ductus arteriosus, again a heart hole, and pulmonary stenosis and an atrial septal defect. If mother is having during pregnancy systemic lupus erythematosus, they can have congenital complete heart block, obesity, particularly among the elite class. The obesity is pretty common, that too during pregnancy. It can also result in these heart holes as well as conotruncal abnormalities. Then phenylketonuria also can give rise to congenital heart disease in form of tetralogy of Fallot, PDA, VSD, and coarctation of the aorta. And hyperthermia can result in obstructive defects due to altered apoptosis. Then these are some of the drugs can give rise to congenital heart disease in the newborn. One is phenytoin, commonly used for epilepsy, can cause coarctation, aortic stenosis, pulmonary stenosis, patent ductus arteriosus. Then sodium valproate is also an anticonvulsant, can give rise to ventricular septal defect, tetralogy of Fallot. Then tricyclic antidepressants can give rise to ventricular septal defect, again a heart hole. Then ACE inhibitors. ACE inhibitors are the drugs we use for hypertension as well as for heart failure, can give rise to septal defect. And lithium, used for various psychiatric problems, can give rise to Epstein anomaly. And these are some of the important things that can adversely affect the newborn as far as heart is concerned. This is just a picture to show how the heart looks. This you can see here. There is a heart hole between the left auricle and the right auricle called atrial septal defect. And another interesting thing, earlier, all these cases were treated by open heart surgery. Because of technological advances and also various refinement of medical gadgets, some of these heart holes can be closed by an umbrella device without surgery. So this is one such case here. We can see here, this heart hole is closed by an umbrella device. This device is inserted through the leg vein, and patient is discharged next day. So there is no scar on the chest wall. So these are some of the technological advances. Whatever may be the technological advances, again, I reiterate, nature is always ahead of technology. And as we do more and more innovations, nature also, for example, you take COVID-19 infection itself. So yes, we are discovering various drugs like remdesivir, steroids to treat, and now we are coming out with vaccine. But virus also wants to survive, so it takes an alternative route in form of mutation. That is how this is the survival of the fittest, and they change their pathways like that. So same thing happens as far as disease is concerned. Another important thing I wanted to emphasize, what is the importance of thiamine deficiency? Thiamine deficiency is pretty common in rice-eating nations. As far as India is concerned, South Indians as well as Eastern India consume a lot of rice, which is rich in carbohydrate. But those who are consuming highly polished rice, excessive washing is done, and those who consume low pulse intake of pulses, legumes, and nuts, as a result, thiamine deficiency can occur. Alcohol and liver disease, long-term use of loop diuretics such as furosemide, and thiamine antagonists, excessive consumption of tea, coffee, betel nut, red coffee. So, what is the impact of thiamine deficiency in the mother on the fetus? This is very interesting. We have published our original article in the Journal of the Childhood. So, particularly those mothers who are eating highly polished rice. Anything polished may not be always glittering. So, a highly polished rice is deficient in thiamine, and those people, those mothers who consume a lot of highly polished rice, their children will be having a thiamine deficiency. And look at this. So, thiamine responsive acute severe pulmonary hypertension in exclusively breastfeeding infants, a prospective observational study. This we have published from Jaideva Institute of Cardiovascular Sciences in Archives of Disease in Childhood. This is one of the landmark study. Why I'm telling is these children born to mothers who are consuming highly polished rice have presented with severe hypertension, pulmonary hypertension, right heart failure, and there was no other defect, because there are many causes of heart failure in children. It could be a heart hole or it could be a myocardial disease. But these, whatever we have studied, nearly 250 infants in the age group of 1 to 6 months, they presented to Jaideva Institute of Cardiovascular Sciences for the treatment of heart failure. Many of them were sick. They were also on ventilation and present with respiratory distress. And it was a great idea of our pediatric, it's a great thought process of our pediatric cardiologist. One Dr. Usha and Dr. Jairangnath, they did thought whether there could be a thiamine deficiency, whether thiamine deficiency is the cause for heart failure. Then we started looking at the biochemical values. There was a gross deficiency of thiamine, and when thiamine was supplemented, 95% of these infants between 1 to 6 months recovered remarkably and went home. So this is a great lesson, and probably this could be an important public health issue as far as infants are concerned. And probably one should supplement thiamine for the mothers, particularly during pregnancy and also during lactation. The thiamine supplement will have an important role. Had we not thought of thiamine deficiency, they would have all died. They would have all died because there was no other cause for pulmonary hypertension in this. So this is the actual picture here. 250 infants between the age group of 1 to 6. 243 survived. Just simple thiamine injection. Just one injection, then another one injection repeated after 5 days. And in fact, many of them were on ventilators. And you look at the pulmonary artery pressure. Pulmonary artery pressure, and in fact, the systematic follow-up has been done. Echocardiography was done that shows enlarged right heart, and pulmonary artery pressures were pretty high, and the heart function was also less on the right side. And on an average, pulmonary artery pressure was 80. Just look at this there was a dramatic response to thiamine in these infants. It dropped to around 20. And we followed up these children for 5 years. None of them has recurred with pulmonary arterial hypertension. So, important take-home message is any child in absence of organic heart disease presenting with heart failure, think there is a thiamine deficiency, then you move ahead. Very important thing. These are important sources of vitamin B1. We are always aware of it. So I think better to consume this red rice or less polished rice. That was our founding fathers or grandparents were eating. So because of this modern lifestyle, people want everything to be pink, I mean, everything to be white, everything to be glittering, and ultimately land up with the problem. So the external layer of the rice is rich in thiamine and B complex deficiency. Unfortunately, in our country, lot of people go for highly polished rice, which can cause a lot of health hazards. Then air pollution. I think this is an important topic. As I was alluding at the stages of epidemiologic evolution, we have moved from malnutrition to air pollution. Particulate matter, sulfur dioxide, organic solvents are known to cause epigenetic alteration leading to congenital heart disease. Because a common man knows air pollution is always linked to respiratory illnesses. Yes, it causes bronchitis, it can cause chronic obstructive lung disease. So that's what is known to common man. But what is less known is the air pollution can also cause congenital heart disease. It can also cause heart attack or coronary atherosclerosis. I will enlarge upon that. And this is a very, very important. Because today, look at this environmental pollution. The pollution, if it is due to nitrous oxide, it can result in tetralogy of Fallot. Carbon monoxide can give rise to ventricular septal defect, pulmonary stenosis, tetralogy of Fallot. Pesticides. Today, this is one thing which has been relentlessly used for all the vegetables and crops. Earlier, we were all using organic manure. Today, we are using a lot of chemicals. We are using pesticides, whether it is flowers, whether it is vegetables to grow vegetables or to grow fruits. So, as a result, this is how pesticides in micro quantities accumulates over a period of time, and mothers consuming all these things can result in transposition of great arteries and ventricular septal defect. It's a very interesting thing. In fact, when I was reviewing the literature, I was shocked to see the impact of air pollution because as far as we know, yes, air pollution affects lungs and yes, it started affecting the coronary arteries, but we never knew that air pollution can also cause congenital heart disease in infants. So what is the impact of maternal obesity? If body mass index is more than 40, it is considered to be a moribund obesity. This is by Western standard. By Indian standard, body mass index more than 30 itself is considered as obesity. And it is also a risk factor for various congenital heart disease. Children born to grossly obese mothers can have ASD, can have a hypoplastic left heart, aortic stenosis, pulmonary stenosis, tetralogy of Fallot. Yes, what is the impact of smoking and alcohol? Alcohol and smoking, a lot of our younger generation ladies, they are fascinated and also attracted towards all these bad things. It can result in 10 to 48% increase in the chances of having congenital heart disease. So the infants born to alcohol mothers or smoking mothers, there is as high as 48% increased chances. These are all, I'm not telling all those, everybody are, 50% who smoke will have congenital heart disease, or 50% who consume alcohol will not, will have this congenital heart disease. It's a chances of getting congenital heart disease is high. So, in fact, just to inject some humor into the talk, alcohol is a device, actually. Alcohol is a device which converts silence into speech. But there is also another interesting device called wife, which converts speech into silence. So there are two important contents of alcohol. Number one is truth, and second is English. A lot of people start talking in English after consuming alcohol, and more often they come out with this truth. Of course, this is on the other side, humorous side of the talk. And alcohol can cause TGA, VSD, cocaine, marijuana. Yes, this is also common. In fact, I have to give an example. Just a week back, a 26-year-old lady came to Jaideva Heart Institute. Almost she was gasping, and she has smoked hookah, and unfortunately she died. So all these narcotic drugs can cause coronary spasm, particularly cocaine, and those who consume cocaine and marijuana can develop a massive heart attack and can die. So this is I will share this pleasant piece of information. So in 2019, the European Heart Journal has featured an article on our institute, Jaideva Institute of Cardiovascular Sciences and Research, as a cardiac center of excellence. This is just a pleasant piece of information. And let us move on to from congenital heart disease to rheumatic heart disease. In fact, there is a direct correlation between your living standard, socioeconomic status, and the occurrence of rheumatic fever and rheumatic heart disease. Look at African countries. For every 1,000 population, the prevalence of rheumatic heart disease can be as high as 15%. In South America, it's high. And in India, in the last 15 years, it has started dropping. Initially, it used to be around 6 per 1,000 population. Now it has dropped to around 1 or 1.5. It is steadily coming down, but because of better living conditions and also proper use of antibiotics for streptococcal sore throat. And look at United States and Japan. It's very, very rare. In fact, if there is a case of mitral stenosis in a medical college in United States, that is a big news. Oh, there is a case of mitral stenosis, and all medical students will just barge into that particular place and start looking at. Even in United States, there are some backward areas like particular Kansas City and all little backward area. There we see some spurt of rheumatic heart disease. So overcrowding, then the poor living standard, and also bad hygiene are some of the things that are contributing for this rheumatic heart disease. This is the current status in our Indian data, roughly about 1 per 1,000 population. It is steadily. In fact, recently we have screened about 10,000 children from the age group of, say, between 6 years to 15 years from Jaideva Institute. Out of these 10,000, there were only 3 children had rheumatic heart disease. So it is less than 0.5. So it's a good thing that is happening. So of course, we at Jaideva Institute of Cardiovascular Sciences, we do world's highest number of balloon mitral valvoplasty. Of late, the numbers are dropping. Initially, is to do around 2,000, close to 2,000 cases of balloon mitral valvoplasty. Of course, 2020, I will take it out because it's a COVID year. So it is just coming down steadily. So a bit about rheumatic heart disease profile in India. If you look at the incidence, mitral valve disease accounts for 50 to 60%. Mitral valve, aortic valve combined is around 25 to 30%. Aortic valve, 8%. Because initially it was thought that rheumatic fever does not cause aortic valve disease, isolated I'm talking about. So even 8 to 10% of rheumatic heart disease, aortic valve disease can be isolated. But if you do echocardiographically, there can be a mitral valve thickening. There may not be a clinical evidence of mitral disease, but there can be a thickening. So what are the special features? I'm going to enlighten upon the juvenile rheumatic mitral stenosis because we are talking about congenital heart disease. So what is the prevalence and what is the pattern of rheumatic heart disease in children below the age of 20 years? And juvenile rheumatic heart disease accounts for 15 to 20%. the time interval between initial attack of rheumatic fever and those present with severe disease is relatively short, because in the Western scenario, there is almost an interval of say 20 to 25 years from the onset of rheumatic fever to the development of symptomatic valvular disease. But in India, the interval between the initial attack of rheumatic fever to the symptomatic rheumatic valve disease can be as short as 3 years. In fact, the youngest rheumatic child with the valvular heart disease had seen is around 4 to 5 years. So less incidence of valve calcification, and also atrial fibrillation is also common among children with mitral valve disease. So this is one of our child was around 10 years who had a rheumatic mitral stenosis, and this is how we can see here. This is an echo. The mitral valve is thickened, it is dooming, and you can also see short axis mitral. We call it as fish mouth. The mitral valve has become narrow due to commissural fusion. So earlier, this was all being done with the surgical valvotomy, whether it is closed mitral valvotomy or open mitral valvotomy. But today, balloon mitral valvoplasty is the procedure of choice for symptomatic rheumatic mitral stenosis. And these are some of the echo pictures. All these are based on Doppler principles. So echocardiography today is no more a special investigation. It is just an extension of clinical examination, and it confirms the diagnosis and extremely useful in decision making. In my opinion, in our medical field, decision making is more important than actually performing a procedure. A popular saying is, decisions are more important than incisions. Decisions are more important than incisions. These are extremely important because a treatment should not be harmful than the disease. That is extremely important. These are some of the indications for balloon mitral valvotomy. Of course, when the valve area is less than 1, those with pulmonary hypertension, those present with pulmonary edema, and pregnancy with severe mitral stenosis. This is just to show this is how balloon mitral valvoplasty is done. I will not get into the technical aspects of balloon mitral valvoplasty. And this is how. So this is our experience. Close to 28,000 cases we have done. This is one of the world's largest series, easily one of the largest series of balloon mitral valvoplasty. This is our experience. Then coming to other disease burden in India. India is facing the double burden of both communicable and non-communicable diseases. In the last 2 decades, there has been a steady increase in the prevalence of non-communicable diseases such as cardiovascular disease, high blood pressure, stroke, and cancer. Nearly 50% of deaths in India today is because of non-communicable diseases, and believe me, 25% of these non-communicable disease deaths is cardiovascular. It is really alarming that younger and middle-aged Indians are becoming vulnerable to these stress-related cardiovascular disease. There was a time children used to bring parents for the treatment of cardiovascular disease. Today, what is happening? Parents are bringing their children in the age group of 20 to 40, 20 to 35 for treatment of heart attack, diabetes, cancer. So it's really alarming, and this is where some preventive strategy must be in place. So cardiovascular disease are the largest cause of mortality, accounting for around 50% of deaths. 4-fold increase in the prevalence of coronary artery disease in India during past 40 years. 7 to 13% urban Indians, 5 to 7% rural Indians are suffering from coronary artery disease. In fact, rural-urban divide is coming down. Earlier, it was considered only a disease of elite class, disease of urbanites. Today, it is also a disease of poor people and disease of rural area. And death rate is higher for a given cardiovascular disease in India compared to the Western population. So some bad news: by 2030, highest number of heart attacks will be in India. This is one of the alarming situation. And some of the unique features of cardiovascular disease in India is in India, everything occurs 10 to 15 years earlier every disease occurs in India 10 to 15 years earlier compared to Western. Diabetes occurs earlier, hypertension occurs earlier, heart attack occurs earlier, even what you call puberty has started occurring earlier, menopause is also started occurring earlier, everything earlier. So for bad reasons, we are taking some top positions. So heart disease rampant even in villages. So look at this top 10 causes of mortality between 2008 to 2010. Cardiovascular disease continues to be the #1 killer, followed by cancer and chronic respiratory diseases and diabetes mellitus in that order. So I think we are in for all these things because this is where environment plays a key role. Environment plays a key role. Environment is not just air and so many other things. So we'll enlarge upon that. What are the conventional risk factors for coronary heart disease? Non-modifiable means you can't change. You can't change the age, except for documentation. People can keep changing the age. Age more than 45. In fact, 30 years ago, age more than 65 was a risk factor. In 2020, age more than 45 is a risk factor for men and more than 55 for women, and yes, family history. See, there was a time we thought premenopausal women are a little bit immune to cardiovascular disease or heart attack. Today, that thing is going away. Even ladies in the age group of 30 to 40 have started developing heart attack. Around 10% of our series are ladies in the age group of 30 to 45. So that whatever immunity or protection they had, because many of these ladies have started working like men, and what we call it as men-ish women group. So then we have modifiable factors: smoking, diabetes, elevated cholesterol, high blood pressure, obesity, lack of exercise, type A personality, alcohol in excess. These are all the modifiable risk factors. I will not get into that. And these are the tobacco. I'm interested to talk about the newer emerging risk factors for coronary artery disease in India. Central obesity, what is called thin fat individual. Overall weight may not be high, but they have a truncal obesity, and it is called thin fat individuals. Dyslipidemia, this is also a common for third world nation, not necessarily India. Dyslipidemia, insulin resistance, elevated plasminogen activator, inflammation, particularly evidenced by CRP and fibrinogen, homocysteine. Homocysteine, some of these young heart attack patients do have high level of homocysteine that can cause and promote clot formation. There is an interesting correlation between fetal malnutrition and coronary artery disease and diabetes. Those children who are born with low birth weight or premature, when they grow up, they are likely to develop diabetes, they are likely to develop heart attack at an younger age group because of their cells will not properly mature enough. As a result, atherosclerosis sets in, beta cell mass also is less. So this data was published in one of the landmark journals. Then we have what is called sitting disease. This is because of our usual gadgets. That's what I was talking about, screen addiction. And if somebody is sitting in one place continuously for 4 hours, it's equivalent to smoking 4 cigarettes. So sitting disease is sitting more time a day kills you. This is some of the research data says. There is 21%. These are all, I mean, not exactly the absolute risk. The chances of getting these diseases is high. There is 21% increase in breast cancer in those who are continuously sitting, and 27% chances of increase of diabetes, and 30% increases of heart disease. So smoking 1 cigarette reduces your lifespan by 11 minutes, while watching TV for 1 hour reduces lifespan by 22 minutes. These are some interesting data. Ultimately, physical activity is very, very important, and see how our lifestyle has changed, our family structure has changed. 1960, a big family, it is a very happy family, and family itself used to be a counseling center. Family itself used to be a community center. lot of, stress management is perfect, and they used to talk to each other. And as a result, all these lifestyle diseases were less in 1960. So what happened in 2000? In 2000, you see, yes, still better. Husband and wife, yes, with 2 kids, it was less. Now in 2020, see what is happening. See, joint family definition itself has changed in 2020. Husband and wife living together itself is a joint family. And see, they are not looking at each other. They are looking into the mobile phone. And as a result, so many problems. As a result, loneliness syndrome, then the screen addiction, they are more prone for hypertension, they are more prone for diabetes. And so this is the real problem. As our giant family has broken into nuclear family, it has made a huge impact on lifestyle diseases. So air pollution and climate change. You look at this climate change, it's so important. Over last 150 years, actually the temperature has gone up by 1.5 degrees centigrade. In fact, this is one of the reasons the prediction is in years to come, unless this climate change is properly attended and properly intervened, unless a proper intervention is done, all glaciers will sink and it will result in a disaster. Globally, 7 million premature deaths is attributed to air pollution, including 1.3 million deaths in India. In India alone, in the year 2019, 1.3 million died of air pollution, and in 2020, 1.7 million died because of air pollution. So, air pollution today is a new public health problem. Air pollution is considered to be a new tobacco, and air pollution is a new type of smoking. Each 10 microgram per cubic meter increases in PM 2.5 level is associated with 8%, 8 to 18% excessive risk of cardiovascular mortality that is equal to smoking. That is the reason today you may not be smoking, but if you are exposed to air pollution, today what happened, it took almost 1 hour 20 minutes for me to travel about 13 kilometers from my hospital to the presentation site, and I was stuck in the traffic. This is where interventions are extremely important. We need to decongest the traffic. What are the major sources of air pollution? One is vehicular emission, and second important is coming from the coals. I think coals is also a major source of air pollution apart from vehicular emissions. And third is construction. Unfortunately, in our country as well as many third world countries, constructions are not completed on time, and there is a huge road dust coming, which is also causing this thing. I mean, as a result, all these projects, whether it's a road development or road repairs, they have to be completed on time. And traffic decongestion is a must. We talk about trees. Yes, trees are the lifeline, I agree. But when you are going for decongesting the traffic, yes, you can go for a metro projects, or you can go even for the flyovers. Couple of trees might be cut, but instead of when you decongest the traffic, you can reduce the carbon emission. As a result, whatever benefit is lost by losing some trees, you can gain by decongesting the traffic. We have to balance between, and if you are cutting a tree, one tree, then probably in its place you plant another 10 trees, but these projects also should go ahead, and there should be a decongestion of the traffic. As a result, air pollution can be minimized. Heavy pollution increases heart attack risk. This is a study from UK. And ambient aerosols and cardiovascular effects. Look at that. The particulate matter less than 2.5, we have an acute effect, and also we have a chronic effect. The acute effect of air pollution is all-cause mortality, cardiovascular mortality. It can also result in atrial fibrillation and sudden cardiac death, peripheral arterial disease and exacerbation of heart failure, and increase in BP and stroke, and increase in hospital admissions, and also suppression of heart rate variability. These are some of the acute effects of air pollution, ambient air aerosols. And the chronic effect is atherosclerotic lesion formation, increase in intimal media thickness, and coronary artery calcification. Then sulfur dioxide, it can cause increase cardiovascular mortality. Then nitrogen dioxide can cause. So these are some of the gases in the air that can cause. Ozone also can cause increase in mortality. So how does this air pollution in form of inhalation can cause a respiratory problem as well as cardiovascular problem? When you inhale these pollutants, particularly the particular PM less than 2.5, it causes pulmonary oxidative stress, it causes pulmonary inflammation and sensory receptor activation. Look at the cascading effect of this air pollution, particularly rich in PM less than 2.5. It causes systemic oxidative stress, inflammation. It can also affect the autonomic nervous system, and alteration in circulating cells and thrombosis. As a result of systemic oxidative stress and inflammation, it can cause atherosclerosis, it can cause hypertension, it can cause cardiac dysfunction, it can cause insulin resistance and endothelial dysfunction. So ultimately resulting in various clinical manifestations in form of acute myocardial infarction or heart attack, and it can cause arrhythmias, it can cause sudden cardiac death, and also heart failure. So wide spectrum of heart diseases can occur due to air pollution apart from lung involvement. This is just a cartoon showing how atherosclerosis starts. I just wanted to emphasize one study, first heart attack survey. We have enrolled about 2,000 odd patients younger than 35 years at Jayadeva Institute of Cardiovascular Sciences, and majority, in fact, the last 5 years data we are seeing, there has been 22% increase in the admission of premature heart attack at our hospital. See, every 5 to 10 years, there is an alarming increase in the incidence of heart attack admission, particularly in the younger age group between 20 to 40 years. So this is called PCAD registry, Premature Coronary Artery Disease Registry, largest documented registry cum follow-up clinic for patients with premature heart attack under 40 years. We started this program in April 2017, and the last 2 years we have recruited more than 2,200 patients under this registry. Every month, the hospital admits 150 young heart attack patients. It's interesting to look at the profile of our risk factors. See, in elderly people, most of them either diabetic, or most of them are hypertensive, or most of them are having high cholesterol. But you look at the risk factors of heart attack in young people, less than 35, you see that smoking is the commonest risk factor, 51, but the incidence of diabetes and hypertension was very less. Another important thing that came out of our study is nearly 16% had a strong family history of premature coronary artery disease. If somebody in the family, maybe among the parents or among the uncles, if they have died of a heart attack at an younger age, such family members are more likely to develop a premature coronary artery disease. So this is a great message. In fact, many people come and ask, doctor, I don't smoke and I don't eat non-vegetarian stuff, or I don't eat red meat, and I consume always fruits, vegetables, and yes, why did I get heart attack? I never had any of these things. I was never a smoker. I was not a diabetic. I was not consuming all these things. So again, a family history. So one of the important message that came out from our study is nearly 30% of our young heart attack patients did not have any conventional risk factors. So here opens up a discussion whether other than the conventional risk factor like air pollution, is it playing an important role? In fact, we did analyze a subgroup study here. 25% who are admitted with heart attack into our intensive coronary care unit were drivers. Either they are auto rickshaw drivers or they were truck drivers obviously they are exposed to more air pollution than anybody. So this is one of the important thing, and stress is an important thing, because many of these youngsters are more prone for high stress levels, because of they are thinking about career, their future, their academic stress, their future job stress, job losses. All these are contributing for higher prevalence of heart attack among the youngsters. And trying to achieve too many things in a too short time, and over ambitious nature of this younger generation is pushing, and they are working from home, working from airport, they're working from till midnight, past midnight, everything. In fact, there was somebody was asking them, see, now you are married more than 4 years now. I mean, what are your achievements? They're telling, no, I built an house and I bought 3-4 cars, and then I got promotions. I floated 2 companies. They never talked about a child, having a child. So these are some of the important issues we should look at that. So these are newer non-conventional cardiac risk factors in young Indians. 40% of these young Indians had high fasting insulin. 30% had a borderline HbA1c level. This implicates the role of pre-diabetes. In fact, pre-diabetes is as an important risk factor as full-blown diabetes. Insulin resistance are quite common in these people. Low HDL with high triglyceride is also common pattern of dyslipidemia among the Indians with premature coronary artery disease. So role of LDL as a risk factor was there in a very small percentage, unlike in the elderly population or unlike in the Western population. And 69% of patients have high homocysteine level. So always when young patients with heart attack come in absence of risk factors like smoking, diabetes, look for all these additional non-conventional risk factors. 73% had low vitamin D levels. In fact, this is also interesting. We did a, because we all, by the time sun starts beating, we are in the office. By the time we leave the office, sunset has begun. And sunset has begun. As a result, we are not exposed to ourselves to sunlight. As a result, we have a low vitamin D levels. So vitamin D is said to, low vitamin D levels is associated with hypertension, diabetes. Of course, I'm not telling vitamin D supplementation prevents all those things, but these are some of the important findings that have been identified in them. That they could play a very minor role. I'm not telling vitamin D deficiency causes heart attack or hypertension, but again, it could play a minor role. And 22% of these young heart attack patients were obese, and polycystic ovary and irregular menstrual cycles were common associated with young heart attack in women. Although in Western population, body mass index of 18 to 25 is considered within normal range. Among Asian Indians, 23 kg per meter square is considered to be a cutoff point. That's I have already said. Infertility is seen as a result of underlying hormonal dysregulation, and fatty liver, whether it is alcoholic or non-alcoholic, is an emerging risk factor for cardiovascular disease. It always suggests there is some insulin resistance going on. So these are some of the important things. So the environment, and what is the interaction of environment and behavior with genes? See, yes, even a prolonged exposure to an environment, if that's what is happening. There are some families who never, their parents, their grandparents have lived up to 90 years, 95 years, but their next third generation, fourth generation are having diabetes, hypertension, and heart attack at an younger age group, but there is no family history. So how these things can happen? Exactly when there is a behavioral changes in a particular individual, when there is environmental changes, maybe air pollution or behavioral changes. So interaction between an environment and the behavior can also cause genetic mutations, and genetic phenotype can change, resulting in premature cardiovascular disease or maybe other lifestyle diseases. So yes, to overcome this air pollution, and also to really, so nature, the time has come, because nature actually doesn't want people actually. So people wants nature. So that is very, very, people wants nature. So we need to promote nature. We have to really, so in that way, now a lot of interventions people are thinking whether they have to move from fuel-based vehicles to electronic vehicles, whether we can move. And yes, we have to grow more and more trees. Most important, you have to decongest the traffic is this thing, excellent issues. So with this probably, so we are always talking about health for all. I think building hospitals or treating with modern drugs, modern technology is not health for all. In my opinion, health for all can be achieved by clean air, by safe drinking water, unadulterated food, tackling malnutrition. I think this is how. So just hospital is one sector. So prevention is better than cure. Precaution is still the best. So again, let us all join and bring a change. Today, environmental activists are playing an important role. Probably in the present context, I think people are getting scared to talk about environment because of some of the things that has happened in the last week in India. I think we as people, as citizens of this world or citizens of this globe, we have to work towards reducing the air pollution. So because that is the only gift you can pass it on to our next generation. Thank you very much.
Any questions?
If there are any questions, I'm pleased to answer, or any suggestions, not necessarily questions. You can also give your thoughts. You can also give some suggestions on this, or your feedback on this is most welcome.
Thank you very much, Dr. Manjunath. It has been an excellent presentation of the congenital heart diseases and the same. And all those people who are there on the net audience must be aware of our Dr. Manjunath's sincere and dedicated service to the patients with heart diseases in India for the past over 3 decades. Now, if anyone has any questions, please. Now, I have a request to suggestion to Dr. Manjunath. You see, while we were mentioning about the non-conventional risk factors, you have amongst the younger people, you have checked the drivers and others who you think are exposed to the auto drivers and truck drivers. You have checked the same with traffic policemen. If any of the younger traffic policemen come to you with heart attacks, I think it's worthwhile checking on their incidence of this heart attacks.
We also actually studied about 500 police, traffic police we have studied, and we are waiting for another 500 to be completed. So even, in fact, I fully agree with you that they are all exposed to maximum pollution.
Thank you. Now, Dr. Jayaji Rao has a question for you.
Thank you for your wonderful presentation, sir. My question is, earlier we used to use this rheumatic heart disease. Almost lifelong process. Now it has stopped. Can you highlight about this? Penicillin.
Penicillin prophylaxis, you want to know? Penicillin prophylaxis?
Yeah, earlier we used to use.
Yeah. Even now you use penicillin prophylaxis, but for the fear of anaphylaxis, some people have stopped using. And if you are not using penicillin injection, you can give either oral tablet or either erythromycin can be given, or even sulfur, of course, cephalexin tablet can be given. In fact, we have studied penicillin prophylaxis. We have submitted that paper for publication. On 2,500 patients, we have given 28,000 penicillin injection, and only one patient had anaphylaxis out of 2,500. So each time intradermal before the full dose, the test dose is given. As a result, so definitely now the recommendation is up to 40 years, patient should be given penicillin prophylaxis unless there is a contraindication, those with an established rheumatic heart disease. If valves are not involved, only rheumatic fever is there, then we have to give for 5 years after the onset of rheumatic fever. Suppose if they have got a established valvular heart disease, we have to continue prophylaxis, either penicillin or other.
Okay, sir. And one more question. Why these heart attacks are more common during early morning period than the anything?
Oh, I think there, of course, is not there is not very uniform data about why heart attack is in some countries it is early morning, because it's all due to circadian rhythm. Because sometimes early morning surge, there is surge of high blood pressure, there is surge of adrenaline, noradrenaline activities, and various clotting factors are said to be more. But there is no uniform consensus that heart attack occurs only early morning. But yes, this is due to circadian variation.
Last question. Why the coronary heart diseases are more common in urban, number one, and less in the rural areas? Probably the environmental, as you rightly mentioned, environmental factors are there.
Yeah, one thing, see, urban physical inactivity is more among the urbanites. Physical inactivity is very nearly 50 to 60% in the urban sector. They are physically inactive. They are very sedentary lifestyle. That is one, and no exercise. So in the rural area, they do a lot of field work. They work in the garden and even in the field. That is one. And another thing is the obesity is more among the obesity and diabetes is more among the urbanites compared to the rural. But another, of course, now indirectly, whether we can say this or not, I don't know. Air pollution definitely is more in cities than in the villages.
So thank you very much, sir.
Yeah, thank you.
Any more questions?
Different
Participants?
If there are no question, we can conclude. Dr. Ravi Kumar is there, Secretary.
No. He has not come.
Okay. I think, ladies and gentlemen, one of the finest discussion we ever had it, and simple way of putting across how we should be able to manage the congenital heart disease, acquired heart disease, from the environmental issues and from the drug, especially the thiamine is the most important, as a matter of fact. Thiamine is the most important, air pollution, obesity, smoking, alcohol, and also you all learned all these things from the expert, the greatest knowledge he has, plus he has the wisdom also over the years. I think that's what he made this statement. I think decision making is most important than the putting the incision. I think we have learned from that one. We are grateful for the time he has given, And thank you for all for patiently hearing. And once again, thank you. Good night, everybody.
Thank you, one and all.
And thank the chairman also, and Jayaji Rao. He's the coordinator of the program, ComHead, and thankfully he's also here with us.
Yeah, I thank Dr. Sriram for chairing this program, and also Dr. Pramesh for this invitation. I really enjoyed this meeting.
Thank you very much. Good night.